ulcer-friendly foods like yogurts, of course, honey. Another big problem which makes ulcers being worse is stress. Even if you do your dietary management very well and you don't manage your stress, because when you have stress, there's a lot of acid being produced. That is if you look at the pathophysiology of how you respond to stress, it results in production of acids, and that one worsens the situation. The other one is, of course, to practice the relaxation techniques, engage in regular exercises, and get enough sleep. I think Dr. talked about rest. The other one, of course, is to use medications as advised, and of course avoid over-counter medications, because most of the medications have got acids. So the more you do the over-counter medications, the more you worsen the situation. The issue is about hygiene practice. You know, one of the causes of ulcers is bacteria, and this bacteria is just, the mode of transmission is just like fecal-oral. You know, when you talk about fecal-oral route, in a simpler term, I don't know how to say, but medically we say you have either eaten someone's feces, because it's through fecal-oral. It's from the feces to the mouth. That's why it's called fecal-oral route. So this bacteria is transmitted through orophycal route. That's why sometimes you'll find that you'll eat in an hotel. Probably one of the people who are serving in the hotel has got this H. pylori bacteria. So definitely if she serves you and she didn't wash her hands well, then definitely you are likely to get this H. pylori. The other one is, of course, to avoid close contact with infected individuals when it comes to H. pylori. The other one is, of course, lifestyle modifications. The other question was about dental caries. Dental caries, that is, I know we have a dentist here, and Nobosire could have done it better, but I'm not seeing him here. So probably just the way to avoid dental caries is to brush your teeth frequently using fluoride-based toothpaste. Brush at least twice a day for 2 minutes. Alternatively, you can brush, if you are able, you can brush after every meal. And what surprises me most is the issue of the brush, the kind of brush you're using. Some of us have used brushes for more than 1 year. For how long are you supposed to use your toothbrush? 1 year? 3 months. And if you have things like Homa, you are supposed to discard it and buy a new one. So if I have Homa today, I should discard my brush and buy a new brush. Yeah? The other one is to remove, of course, remove food particles and breakage. Of course, things like you limit sugar and acidic food drinks, avoid frequent snacking, choose water or milk instead of sugary drinks, visit your dentist regularly. Of course, there is the issue also of additional tips like you can do what we call, there's that cleaning, thorough cleaning, which is done yearly. Yeah? Do we do it once a year by dentists? Just leave alone about the brushing. There's that detailed cleaning, which is supposed to be done once a year. How many people have done it this year? Wangapi? Wameenda kwa dentist, wameoshwa na dentist, sio kujiosha na brush? Yeah, you see very few of us. So it's necessary to do it once a year. I think those are the few questions I had, because the questions are many. Probably we may get enough time to talk about these 2 topics into details. Thank you, and back to you, Dr.
Mesikia brush mnatumia mara ngapi? Ukiwa na homa una? Okay. Learning is continuous. So then a question to Pastor. In this day and age, with the age of Kasongo and all going on, and life is happening right, left, center, how, as a Christian, how do you handle or how do you cope with depression? Welcome.
Thank you. I don't want to answer everything. Now I have to engage you, because we should not work on the assumption that you don't know anything. What is depression? What is our understanding of depression, the word depression? Because I saw even my sister who was struggling to translate sign language got to a point where everything was like, she could not even interpret what we are saying because of the medical jargons. So we want to try to be as layman as possible so that we communicate. That's the objective of communicating. You need to understand what we are saying. So at what point do we say somebody is depressed? Because if we don't know what we are talking about, then even the management will not be there or may not be right. So what I think, Daktari, probably would be important for us is having understood when one now is not able to function normally. We need to go to the signs. How do you identify one who is depressed? Because if somebody who's been active all along, has been freely mingling with others, all of a sudden you start seeing some funny behaviors, like you'd want to be a loner, withdrawing from people, the performance is declining, a lot of things, then you should see that, you should suspect. Yeah? Many of them we have in our houses. Some of them can even lock themselves in the bedroom the whole day in the name of somebody trying to study or just like being alone. The next thing you hear, somebody has committed suicide. So if we don't do early detection of the signs so that we can also intervene at the right time, then a number of times we respond when things are out of hand. So number one thing which I would say is early detections of signs and then knowing the appropriate measures to be taken, which includes social support we talked about. There are referrals we can consult with the therapists that we have. We have counselors, even psychiatrists can be now roped into the management. Yeah. You want me to continue? Then somebody is asking that, can you tell us what we mean by the word alternative medicine? Then I will respond to the question of what is the church's position about alternative medicine?
Brings us to what is medicine. Then, so when we describe what is, then we can now look at what is not. Yes. Then what is, the opposite is alternative medicine. So medicine, as it were, from the definition we got in the morning is how do you say you're healthy? What are the aspects we talked about? Your mental, please engage me, your mental, physical, spiritual, and social well-being. So that is the definition of health. And then the study of that and the study of the treatment of issues pertaining anything that affects any of those factors, that is medicine. Yeah. So then there are molecules or there are drugs, there is science that has been described, researched, and proven. Yeah. So that is contemporary medicine. On the flip side, so if you now on the flip side of what we've described, that is alternative medicine. Yeah. So then the question now is, to this form of medicine, what is our stand as a church? Or what does it encompass? Maybe if we may start there.
Okay. I would not say that the church has a very clear position on this, but from what I have been laboring to explain since morning, they have given us the guiding principles. When I was talking about evidence, we are not downplaying the fact that somebody can use even, there are some plans people can do for even steam inhalation, and we have seen them work. We have seen them work. But we really need to be very careful. Lately there is a misnomer, I don't know whether to call it so, where people have been trained to believe that any herb which is bitter is meant for the stomach. Does it happen in this end of the world? So then somebody gives you a concoction, like almost 6 liters, it is just by the bedside. By the end of the day, somebody's kidneys are shut. When somebody comes to the hospital, I remember from the experience I had when I was working at Kisii Adventist Hospital, way back in 2000 to 2006, then what I would see is that anytime a baby was brought who required transfusion, and then we go ahead and administer the blood, but somebody has been on herbal, then there was like an anaphylactic reaction, I don't know what. Then these people would just die. So I think it is important for us to know and have the evidence, like the principles we have been given. Number one, remember I talked about inspiration, evidence, and then I talked about what? Balance. So those principles are supposed to guide us even as we choose on which one to employ for our well-being. Are we together? Yes. I think that is all I have here. What weight management? What is normal weight? How do we arrive at normal weight? When do we say somebody is overweight? BMI. That runs around 18 point to 24.9, 18.5. Yeah? So you needed to know your weight against the height and check. But of course, there is also, we have confiscated medical equipment that today will give you more details about your BMI, including the lean mass, the water content, everything. Because lately I saw a research, I don't know whether you came across it, that BMI of weight against height alone is not confirmatory. And they were saying that there are individuals who probably are having bone mass which is just too massive. That may make things to appear to be abnormal. But when you check, you realize that they are very normal people. I once saw a patient who was wheeled into the theater. Then I was working as a theater nurse. And what I saw, the guy was very lean. But when we opened the abdomen, it was, you call it a theroma, ni mafuta almost everywhere. So don't also be mistaken that when you are lean, you can't suffer these conditions like high blood pressure. You do well to always confirm, go for medical checkups in time so that you can be assisted. Early detection is always very important in any management. Thank you.
Thank you. I forgot to say about, the question was about management. Of course, management is, of course, medical, apart from the prevention part I said for ulcers. Of course, there's a drug called Esokit. Esokit is a drug which is a combination of 3 drugs, which were given either for 1 week or 2 weeks, depending on the physician who is seeing you. The other issue I didn't say is about why should you avoid sugary foods. One of the dirtiest organs in the body is the mouth. Did you know that? Did you know that? Do you agree with me? One of the dirtiest organs in the body is the mouth. That's why mtu akikuuma, what happens? Why does the wound take a long time to heal? Because it has a lot of bacteria. So if someone bites you, the wound takes a lot of time. That's why even if you go to the hospital, sometimes the wound cannot be stitched. Because if you stitch, sometimes you make it more worse. Because there is a lot of bacteria in the mouth, which is then transferred when someone bites you. That's the reason why if you take a lot of sugary now, a lot of sugary foods, you know the sugars strive, bacteria like sugar, so what happens, the bacteria will attract that sugar, and then it will start forming a kind of, how do you call it, a hole, which now goes deeper into your nerves. The pain from the tooth comes from those nerves now when they're exposed. Thank you.
How many of us have had boils? Ekenyabororo, sindio? How many of us have had such? Raise your hand confidently. There's nothing wrong about it, yeah? So then the question we received was, what is the difference between a tumor and a boil? Yeah? So a boil is an infection, yeah? A tumor is, by vague definition, ni kitu yoyote ambayo imefura, yeah? So then a tumor can be either cancer or non-cancer. But boil, as we've had it, all of us, most of us in the past, it's something that comes and goes. And in a lifetime, it can come back again or not. Yeah? We agree? Yeah? So then the other question was, why most tumors mostly become cancerous after surgery is done to remove the tumor. So then the question in itself is a misnomer in the sense that, so usually the process is if there's a swelling, there's a sample that is taken for analysis. This analysis is done to determine if this growth or this tumor is cancer or not cancer. Then the decision is, should we remove it or should we have surgery on it or not? So sometimes there are tumors that their growths that look normal. Then when these cells are taken for analysis, it looks like this is cancer and not normal cell as we thought initially it were. Yeah. Number two, there is usually another misnomer in the society that if you have cancer and surgery is done on you, that is equivalent to death. Yeah. So the issue is what is the cancer, one, and what is the stage of the cancer. So there are cancers in the early stages that are amendable to surgery, that is curative, if we may put it that way. So then for those, treatment is for curative purpose. Then there are those stages that are more advanced. If you hear your doctor telling you your cancer is stage 3, stage 4, then start thinking this surgery is probably not for cure purpose. Or this surgery is maybe to alleviate some symptoms that I could be having. Yeah? Or there are other alternative ways to have this. We've had people being told of going for chemotherapy, yes? Others told of radiotherapy. True? True or false? Yeah. So again, it depends on what is the stage of cancer. So surgery in a cancer patient is not equivalent to death. I think those were the two questions. Or the other one is about how do you handle a child with protein intolerance. So the first thing is to identify what is the protein that is causing this reaction to the child. So labda anapewa maziwa, anapewa, what is the other protein you know? Another one? Yeah. So then you realize there are proteins that when you give, so usually proteins you can either have plant protein or animal protein. So there are proteins that if this baby is given, you tend to realize the reaction yenye ulikuwa umeona, labda anakuwa na rash, ama anafura macho, ama anafura vitu hizo like boil like or blister like things, yeah. So you tend to realize there are certain meals that if given, or certain proteins if I administer, they tend to have that reaction more. So step one is to avoid. Usually they say you cut off completely. Cut off the protein, then start introducing one at a time. Sometimes umempea mkorogo, like umempea everything. You don't know, was it the meat that I gave yesterday, or the fish that we did at lunch, or the chicken that we did the other day. So the trick is cut off completely, then introduce stepwise. But that said and done, it's important to always consult for children, your pediatrician, and your physician for the adults. Thank you.
Thank you. A friend of ours is saying that, what can I do to have food temperance? Because I love food. In bracket, eating. And if I reduce the portion of the food, my body shakes. To the point that I lose energy. This has led to a challenge in my weight. That is the question before us. I think this is, since we started, I'm not downplaying the rest, but this is very honest. That's why you find something to smile about. One thing I would say, there is a lot that goes on in the mind. How many of us here, my questions are always looking very stupid. When you have enough money in the pocket, you can even postpone your eating time. But when you don't have money, you wake up hungry. In fact, you're hungry in advance. So there is a lot about the mind that should be trained. Number two, I want to say that you need to increase protein in your diet because it gives this feeling of satiation. You feel like you're satisfied. Increase the fibers, which will keep the stomach full for a while, as opposed to this other highly sugared stuff, which will only lead to spikes of insulin, and then sudden drop, then you have the feeling that you want to feed again. Are we together? Are we communicating, church? Yes. Then we say also, you need to hydrate yourself well. Need to drink enough water. Somebody has said, that's a nutritionist, that even while eating, you need to eat and pause. Sometimes in between meals, put even your spoon on the table. It is not a non-stop battle. With the rest in between, you will take the needed amount. Are we together? Yes, so cut down on sugars, which again contributes to these weights which we are not able to control. If you can check the type of diet you take, you'll find there is a lot of, the fries, the so-called fries, friends, they are hurting us. We know fries. Don't turn your mouth into to be a laboratory for testing every food. This is not a lab. So be intentional, and then you can start by weaning off, just like when you win a baby. Habits cannot be stopped at once, so you can gradually withdraw. Try with 3 meals. By the way, it is proven from the book Counsels on Food and Diet, and even medically, that 2 meals are adequate for any ordinary person in a day. How many people believe that can work? 2 meals is just enough. And if ever Jesus or God ever forgot at one point in the Bible, then he forgot to supply lunch for Elijah, because the raven was only bringing breakfast and dinner. I hope somebody got what I'm trying to say. So 2 meals are enough. Tone down on carbs. Increase the fiber so that you feel full most of the time. Hydrate well. Lower down on the sugars as much as you can. And then things will be fine.
Thank you, Pastor. I would like to respond to one more question. There's someone who asked a question about why is it in the recent past there's a rise in people using glasses and eye problems, both in children and even adults. So I would like to respond this way. Poor eye health is caused by a number of factors. So many factors come into play. For someone to wear glasses, there could be so many reasons, and people wear glasses for different reasons. The first one is when people wear glasses, it could be they are long-sighted or they are short-sighted, or probably they have a problem with lot of light, so they are given glasses called photochromatic glasses. So there could be so many reasons why people wear glasses, and I will give you different reasons. Number one, people could be having genetic reasons, and that is why you will find if I am wearing glasses, my wife is wearing glasses, there is always a very high likelihood that our child will wear glasses. And most of the time, the error that is being corrected by glasses is likely similar. If your parents are short-sighted, you have a gene defect likelihood you will have short-sightedness. That's one. That most of the time it's non-controllable from a human perspective. But there are several other reasons which you can control. One of them being our environmental exposures. The reason as to why so many people land having glasses is screen time. We spend a lot of time on the screen, especially if you're using laptops or your job dictates you have to use a computer. You use your computer the whole day, 12 hours of the day or 8 hours of the day, 8 to 4. When you go home, you carry your work home. You still want to use your laptop at home. So the period in 24 hours that you are exposed to a screen is increased. And when you look at a screen, there are particular light that it emanates for you to be exposed to. So a longer duration of exposure to the screen affects your eyesight. With time, you will find some people scratching their eyes. You will find there are people having challenges with exposure to light. If they get to the sun, their eyes will ache. At the end of the day, after looking at the screen the whole day, they will have headache. And therefore, this exposure is a key factor to many people having eye challenges. Now, in our children, We have brought up our children in a way that they are exposed to phones, to tablets, to iPads, to televisions. All those are screens. And they emit particular rays. And some of the screens emit rays that affect our eyesight. We as parents, we've gotten to an age where we don't want disturbance. If a child is disturbing you and you want to engage him, you just give him or her the phone without knowing that we are affecting the eyesight for these children. And I can tell you for a fact, statistics have shown that those children who have been exposed to screen time for a long duration, in class, they tend not to see the board. So most of the time they will struggle or they will want to sit closer to the board. And the reason is the blackboard is a black board, which is not as bright as a phone could be. And they will be having their phone at a very close proximity. And the muscle strength of the eyes will tend to associate themselves to look at things more closely than looking at things at a distance. And therefore they end up with the disuse syndrome in their eyesight. A few other factors could be dietary factors. We are feeding in the recent past diet that is not very palatable to our bodies, in the sense that we will find ourselves eating, I like the example Pastor gave us, you eat uji and boiled maize, which is carbohydrates. We forget that we need to take vitamins. Our bodies also need vitamins to strengthen our eyesight. There is particular diet or some particular vitamins like vitamin A, which will strengthen eyesight. Like vitamin C will also help our eyes and our bodies to have stronger immunity to infections, which will be my next point. And therefore, we subject ourselves and even our children to diet. We are more into Weetabix, Indomie. We forget that we need to give our children vegetables, chinsaga, enderema, and all that, so that they be able to build immunity and avoid vitamin deficiency. So vitamin deficiency is also a factor to eye health challenges. Another factor is exposure to occupational, risks. For example, if someone is working in a quarry, is exposed to dust the whole day, the entire time, longer duration of the dust and some other micro minerals that get into our eyes will likely affect our eyesight. And that is why when you are working in a certain environment, you are being advised to have a protective gear. If you are a farmer and you want to spray your vegetables or you want to spray your cows, ensure you have goggles or something that will protect your eyes from being exposed to some chemicals. At immediate value, you might not see the effect. But a long-term exposure to these chemicals and also some kind of dust will put you at risk of not just even the eyes themselves. We even end up with other things like cancers. So we are being asked to ensure that if we are having some kind of exposures, we protect ourselves so that our bodies and including our eyes can be protected. In the recent past, we've seen a rise in diseases, the non-communicable diseases. The common culprit is diabetes, hypertension. So people who end up with diabetes and they don't control their sugars as effective as needed, they will end up having challenges with eyesight, with their eyes. And therefore, we are being asked to do early screening and manage our chronic diseases as effectively as possible. If you have hypertension, you will end up having what we call intraocular increased pressures, which at the end of the day will also affect your eyesight. So members, generally we are saying we take care of ourselves. Out of the many reasons, so many factors that I cannot cover here this afternoon, they do affect our eyesight, including smoking. Studies have shown that smokers over long durations, those people who take more sticks, that means more cigarettes in a day, are likely to have eye problems compared to people who do not smoke. People who do not have adequate sleep also at the end of the day, by default, have eye problems because of reduced immunity, high chances of infection, and such things can subject us to, eye problems. Living in particular environments like in the Maasai community where, there's a lot of dust, we are chasing animals, eye hygiene, we can be subjected to eye infections like glaucoma and a few other things. And so, out of those many reasons, that is why we have a rise in eye health. Thank you.
Thank you, Brother Joel. I hope these are the last questions. I think someone was asking about the causes of ulcer. I think I've already addressed that. I said one is a bacteria called Aerobacter. The other one is non-steroidal painkillers. The painkillers we take, over-the-counter painkillers, some of them cause ulcers. And then, of course, like my father, every time utapata jioni anaambia mfanyikazi, kimbia ulete Panadol 2. Nilete Panadol, namuuliza hizi Panadol ni za nini? Ni za pain. Mpaka saa hizi akiona niko karibu sasa anamwambia enda ulete ile kitu. So you see, you are taking painkillers every time until they cause ulcers. The other one is stress. The other one, of course, is overproduction of ulcers, overproduction of acids. There are also some medical conditions which causes ulcers, and of course, lifestyle factors. The other question about what causes ebichege, I don't know, ebichege on the fat end of the tongue. It's not very clear to me, but if it's inside the tongue, most likely what I can suspect is a what. What causes a what is called human papilloma virus. It's a virus which causes what? Human papilloma virus. It's the same virus which causes cancer of the cervix. But we have got different strains. There is strain 16 and 18, which causes cancer of the cervix. The other one is strain 6 and 11, which causes warts. Warts are like cactus. They are very beautiful. Sinamea kama cactus. So, and they like the private part of our bodies. So, probably what I can advise you, you can see Daktari, probably should be able to review. The other one, what causes the knee joint only on one knee? What can cause knee joints is probably could be trauma. It can be arthritis. So, also you can be checked so that we can really get to know. Probably you can be taken an x-ray so that we can be able to evaluate and see what is the problem. The third question, what affects one knee? Some pain on only one knee, I think that is the same thing. And the last one is causes of one feeling pain on all his ribs, mostly when sitting. If there is pain on the ribs when you are sitting, probably I can just imagine one could be, let me start with the basics. It could be the sitting position. You know, most of us like sofa sets, but I want to remind you that those sofa sets are the cause of many of our pains, because you find that the sofa sets, the back it makes the back to bend so that your back is supposed to be straight when you are seated. So avoid sitting on those sofa sets. Your sitting position matters a lot. The other one is, of course, it could be an infection which is developing inside the lips. And of course, the other one could be I can also imagine of the profession where you're working. If you're pending a lot, probably it can also result to pain on and off. Thank you. Probably, Daktari, I don't know whether you know ebichage. 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 Daktari, maybe you know what is ebichage.
Happy Sabbath. So I'd wish to ask that we hold on and postpone this interesting Q&A session. So we are looking forward to an online or virtual session that will run throughout a week. Just a similar forum where we'll be inviting a professional. If it's in matters surgery, we'll have a professional handling questions on that day. If it matters medicine, we'll have a specialist handling questions on that evening, maybe via a Zoom session, so that our health care is brought nearest to us. So without further ado, I'd wish to welcome the Aga Khan lead team to Just say a word. Thank you.
Thank you so much. Happy Sabbath. My name is Caroline. First and foremost, I would really wish to thank the leadership of the church for allowing us to be with you here today. We've been offering basic screening at the tent on the far end. So number one, I believe that most of us are familiar with this saying that goes, prevention is better than cure. So we've been doing some basic tests such as sugar tests, BP checks, optical checks, and of course BMI. So those are just basic tests that lets you know your status in terms of what your pressure is, what your BMI is, and of course your sugar levels. We've encountered patients who come to the hospital when their pressure levels are way above on the roof. So we normally encourage people to do regular checks, especially the pressure checks. When you visit any facility, not just Aga Khan, these are usually done free of charge. Number two, we have wellness packages. Wellness packages are basically a series of lab tests that are customized according to your age or gender to help you know the status of your health again. I had one speaker this morning talk about cancer, one of our cancer survivors. Those were very beautiful testimonies. And just going back to my point of prevention is better than cure. Once you do these wellness checks, this series of checks, normally we just take your blood, and we normally take your blood through a series of tests. And we have some tests that are called cancer markers. So cancer markers just help the medics to detect if there are any abnormal cells in your body. And most of us, or many of us, have relatives or people that they know that have succumbed because of cancer. And this is due to the fact that they never knew about the cancer existing in their bodies, and maybe they're knowing it at the very last stage. So we encourage people to do these tests so that if there's anything abnormal in your body, then it's caught in good time.